Thank you. So we have a couple of introductory comments, if I might, about this PSI survey. We're talking about the results for PSI version 4. This survey is a survey of general practices. The surveys that and the work that we've heard so far is with consumers about various things. This is a survey of patients sitting in the waiting room of general practices. It's possibly familiar to some of you that the RACGP approval process requires patients complete surveys evaluating the services provided by the practice. PSI is one of those surveys, and this is conducted in that sort of environment. So therefore, it's a little bit different from some of the stuff that you've seen already. A couple of comments on the survey. I mentioned first of all that it's approved by the RACGP. One of the consequences of this is that the RACGP requirements are that there be 30 surveys completed per full-time equivalent GP. So if we're talking about a solo practice, there's 30 patients completing a survey. If we're talking about a 10 GP practice, we've got 300. So that can sort of affect the numbers in some way. I've included a picture of the survey there. Two comments to make on that. The first one is that more recently we've produced a new survey, the 5th version, which has been reduced to 4 pages. The second comment is that a large part of that survey is about the patient. One of the things that we find, and it's been touched on in some of the presentations already, is that the patient characteristics affect the evaluation of the services that they provide. Older patients, younger patients, patients that are feeling better, patients that are feeling worse, retired patients, employment, we see differences by employment status, age. There's also a lot of questions in there about practice usage. Some of them are continuity of care sort of related, and some of them are service usage related. I'm not going to touch on any of that today. The situation that I'm quite excited about is the fact that now, for the first time as of, I think, Tuesday morning, we've got the database built and loaded up into SPSS and all sitting there ready for me to start asking questions of it. So what I've got at this stage is 27,649 patients drawn from 255 practices. It's a fair database. I'd like to comment that that is a good sample of patients. Okay, when we quickly match those patients' age and gender only at this point against the Beach data, which is pretty much the gold standard for practices. We're very underrepresented in patients under the age of 25. We have very few patients under 25. But in the 25-year age brackets plus, we virtually perfectly match Beach data. And the other comment in both age and gender. The other comment there is that it's a fair sample of practices. 250 practices is enough for us to be able to start to look at the differences between practices. So what I briefly want to do, and I've really only got a couple of slides of data for you, because that's all I've really had the time to draw together, is to show you some of the results from these 2 questions. The method on the survey is that patients get asked to complete the survey beforehand. There's a whole lot of questions about the practice itself, the access to the practice, where you know, people warm and friendly and all of that sort of stuff. They go into the consultation, they come out of the consultation, and the first question they get is, who did you see today? The options on who did you see today are my usual GP, a GP I've never seen before, a GP I have seen before, a nurse, or someone else. The usual GP never seen before, and GP I have seen before are really important distinctions. One of the things that the college in particular goes on about as far as quality is concerned is the importance of having your own GP or seeing your usual GP. The idea of a usual GP is, as I think somebody's mentioned, that you know, you build a relationship with them, you'll have trust with them, you'll presumably have higher satisfaction levels with them. The concept of a usual GP is an important quality metric. And then we turn around and ask them how satisfied they were with each of those. And I'll show you that data on the next slide. Sorry, the slide after that. And later, we ask a whole lot of questions about the consultation, interpersonal communication questions, information provision questions and things like that, which I'm looking forward to digging into. But for today, first of all, who did the patients see? Now, the way I've represented this data is, first of all, if you look across the row of my usual GP, on average, 60% of those 27,000 patients saw their usual GP. But if I look at the 255 practices and look at the range there, I find that anywhere from 10 to 97% in different practices. Now, you'd expect that in a solo practice. Okay, if you're talking about patients in a solo practice, well, you'd expect that everybody's pretty much going to see their usual GP. And that's what happens. The exceptions, thank you, the exceptions are those who are new to the practice, who've never been here before. I'm curious about those practices that have only 10% of patients seeing their usual GP. Similarly, a GP I've seen before, GP I've never seen before. It's the practice nurse numbers or the nurse numbers that you're probably most interested in. I'm not sure how they tally with anything else that you've ever seen. 7.5% of patients saw a practice nurse. Of course, they may have seen more than one person. So that's why I put the subset that 2% of patients saw a practice nurse only. And if you look at the range, anything from 0% to 57% of patients might see a practice nurse, and 0 to 13% of patients might see a practice nurse only. They're pretty fair ranges, and one of the things we'll be interested in doing is exploring the differences between those practices. Are they different sizes? Are they different locations? Are they different? Who knows what they might be different. The next slide is the one that shows you the satisfaction scores, and I'm not sure what you're expecting. You might move straight down the bottom and see that the practice nurses are looking very nice, thank you. But let me draw your attention to, first of all, how I've drawn the graph. We've taken the mean satisfaction score. As you saw earlier, it's asked on a 5-point Likert scale, so we've simply taken the mean of those and then plotted the 95% confidence intervals on those. Basically, when the confidence intervals don't overlap, you can assume there's some sort of a difference there. And if you look at the usual GP, the GP you've never seen before and the GP that I have seen before, you can see the trend that you expect to see. People are much more satisfied with their usual GP and less so with the GP they've seen before, and even less so with the GP they've never seen before. One of the reasons I've taken a little bit of time to sort of set up the importance of the usual GP is because I want the message to get through that practice nurses are just as good as the usual GP. I think it's an important message. And while the numbers are smaller, they're still sufficient to be able to say that for those people who only saw a practice nurse, they're still doing as well as the usual GP. So I'm going to skip on to the next slide. I see some nods. And I've certainly had my 5-minute warning. One of the things that I mentioned earlier was the ability to see the differences between practices. And what we've done here is I've looked quickly into 2 other questions that are important to life in my mind. The first one is, there's a question there asking about the patient's perceptions of the teamwork, the way the GP and the practice nurse work together. And there's a broader satisfaction question asking about satisfaction with the services provided by the practice overall, the overall sort of satisfaction, global satisfaction question. And in this graph, I've plotted the results for each individual practice. Okay, so each dot represents one of those practices. And you can see there's a strong relationship between the patient's perception of the way the team is working together and the satisfaction with the services provided by the practice overall. And that's really all I've got to show you. I hope I might have teased you a little about the stuff that's still there. There's a lot of stuff about patients, there's a lot of stuff about practice, and there's going to be lots of fun had by some of us looking into that data over the next few months and the rest of this year. If anybody's got any particular questions or things they'd like to know, or lines of inquiry they'd like us to pursue, I'm certainly interested in learning more about those, because one of the things we really want to do is get value out of this data. We believe it's useful. We believe there's potential to do things with it, and we'd really like to be able to encourage that. Just in summary, I probably don't need to read it, but they haven't sort of started making ugly waving hand noises at me out the back yet. 7.5% of patients are visiting. Sorry, 7.5% of patients visiting general practices are seeing a practice nurse. 2% are seeing only the practice nurse, and the range is large. Patients are as satisfied with the practice nurse as they are with their usual GP, and the perception of GPs and practice nurses and the way they work together is a really important driver of satisfaction with the services. So on that note, I'm going to say thank you.